Hi there, let's continue with the urinary system, and in this video we will be focusing on the congenital abnormalities of the ureters. Remember the two kidneys and the two tubes that connects the two kidneys to the bladder, and then from bladder down we have urethra, and through urethra the urine goes out of our body, right? So those two tubes are the ureters, and what are the congenital abnormalities that we may have? So that's what we are going to look at in this video. So one can have duplicated ureters, also known as a duplicated collecting system or duplex kidney, and that is the most common birth defect related to the urinary tract. Both boys and girls are affected, but the condition is more common in girls. Ureters are long, narrow tubes that drain urine from the kidneys to the urinary bladder. Normally, one ureter leads from each kidney to the bladder. So, in case of duplicated ureters, the two ureters drain a single kidney. One ureter drains the upper part of the kidney and the other drains the lower part. This condition may affect one or both kidneys. Duplicated ureters can take one of the two forms. So there are separate or additional ureters that at one point they merge, called incomplete version of the duplicated ureters, and or you can have a complete version of the ureters where the two ureters are separate and they remain separate. Okay, so incomplete, they are separate, but at one point at some distance they join together to form a single ureter that enters the bladder, and the complete remains complete. So this is the slide that shows normally we have two kidneys, two ureters, and the bladder and the urethra, right? This one is ectopic ureter, where you have two kidneys, and see the ureters, there is extra ureter over there. So there are two ureters in that kidney. So how common are duplicated ureters? And there are data that indicates that about 0.7% of the healthy adult population and 2 to 4% of patients with urinary tract symptoms have duplicated ureters. Incomplete versus complete, different forms of the abnormalities of the ureters that we were talking about. So when it comes to incomplete duplication, is 3 times more common than complete duplication, which is estimated to appear in about 1 of every 500 people, just to get an idea as to statistically where we are. So the duplicated ureters are a result of errors in cell division that occurred during the development of a fetus, the baby inside the mother's womb. There is no proof that anything during pregnancy causes the defect. However, there is evidence to show that the condition can be passed from a parent to the child, and there are 50-50 chance that if a parent has it, there is a possibility of the child who may be born, they may end up having that condition. What's the bottom line? As long as the duplicated ureters drain normally into the urinary bladder, they should not cause any symptoms. If symptoms do occur, it is usually in the case of complete duplicated ureters. Duplicated ureters can occur with other abnormalities of the urinary system. One of the more common one is Ureterocele. So what is Ureterocele? Ureterocele, and I'll show you the slide as well. What happens in Ureterocele, the end of the ureter does not develop properly, and hence the urine flow is obstructed. And as a result, balloon-like swelling as urine builds up at the point where ureter and bladder connect happens. And in addition, it may result into the reflux as well, which means instead of going downward, there is a backward flow, the reflux, towards the kidney through the second ureter, which often has a weak valve because it joins the bladder in an abnormal location. So let's take a look at the Ureterocele. So you see right there, that's what the Ureterocele is. And we have a duplicated ureter right there. So a number of symptoms can occur when one of the ureters is ectopic, which means not normal, simply speaking, but precisely it means that it drains to somewhere other than the bladder. So the symptoms of ectopic ureter include hydronephrosis. What is hydronephrosis? Simply speaking, too much urine in the kidney. What happens here? The ureter is narrower than it should be. As a result, obstruction in the flow of the urine, and hence urine gets backed up and causes the kidney and the ureter to swell. Then next comes the urinary tract infection. So because of the poor drainage, it is easier for the bacteria to enter urine and travel to the bladder. So the urinary tract infections result in a painful urination. And of course, then you can also have incontinence, which is basically leaking of the urine or the inability to control the urine. The reflux is, as we just said before in the prior slide, that urine backs up and flows in the wrong direction, upward towards the kidney instead of going down towards the bladder. And of course, when it comes to the reflux, it is important for the doctor to know we are talking about congenital. So it is important for the doctor to know the amount of reflux as a child may be able to outgrow a small amount of reflux, but may need more extensive treatment if the reflux is large. So it's not that the reflux happens and you just think that it's too bad. It may go away. So of course the doctors will look at the overall profile of the child and look at the different aspects to arrive at whatever necessary treatment that may be required. The kidney infections or other damage can also result from the reflux. So these duplicated ureters are usually found during childhood, but sometimes they are not discovered because they remain perfectly normal as far as their function goes, and as a result you may not notice or you may not discover until later in the adulthood. And sometimes the symptoms may resemble with other health issues, other medical conditions. That makes it difficult to diagnose. And of course, if needed, then a number of tests can be done by the doctors that may include the ultrasound or the voiding cysto-ureterogram, CT scans, MRI as appropriate as may be necessary and needed. So when it comes to congenital abnormalities of the ureters, most of them do not need treatment. However, if it requires treatment, then the treatment is surgery. And that will eliminate the incontinence and the decrease in the chance of infection. This surgery should be used only when the kidney function is poor and the other kidney is operating normally as a precaution. Now I just added this couple of procedure or the surgery to remedy the situation. Okay, so this covers the congenital abnormalities of the ureters. Lot to cover on the urinary system. I will see you soon. Take care. Bye bye.